Thanks so much. I'm just gonna full screen my slide. Great. So thank you all for joining me today. I really appreciate the invitation to speak in this last seminar. And greetings from Toronto. So the talk today is kind of covering a lot of different aspects of working conditions and physical activity. And there will be even a little history lesson we're going to start off with. And so I want to cover first physical activity in the workplace context. So thinking about the role of work and how that impedes and facilitates physical activity. And then I want to segue into thinking about how we can actually overcome some of these barriers and barriers, not just looking at white collar work when we're thinking about desk-based work, but looking at more, encompassing varied work. And we think about workers in non-traditional jobs or in jobs that are not just desk-based. And then I want to give you an overview of this occupational physical activity paradox, which some of you might have heard of, where physical activity done at a very high exertion at work can actually be bad for you. And then I just want to finish off with providing what my recommendations or what my research shows, kind of an overview of what I could probably give you for safe and healthy physical activity. I'm saying probably because there's still a lot of contention, and I'm also open to your comments and feedback as to what I need to be thinking about as well. So let's begin. So I said I'll start off with a history lesson, and it's interesting because whenever I talk about physical activity to occupational researchers and epidemiologists, I like to bring up this story, and some of you might have heard of this, and it's a story of kind of the conflict of around the importance of physical activity for health. And so, we take for granted right now that physical activity is something that's really important for our health. But that wasn't always very well understood. We mostly were based in, beyond 50 years, in the last 100 years, we started to really, there was a lot of contention and kind of opposing schools of thought and paradigms as to what it was about our lifestyles that influenced our health. And so in one school of thought, we had this idea that physical activity, was important for health. You go for walks outside while thinking and philosophizing, and then, you're generally, you feel better, you look at athletes in the Olympics, ancient and modern, and they're generally, quite impressive specimens. And so that was that one paradigm, which is physical activity is good for you. And then the other paradigm is that it's actually low stress. Being in a low stressful environment is what is good for you. And so, and then you equate walking with actually being in a low stressful environment. And so this contention, there wasn't a lot of really strong and compelling epidemiological population-based studies to really understand if physical activity was important for health. And so an important study by a researcher called Jeremy Morris in the 1950s, published in The Lancet, did something which is very interesting, where they looked at a group of workers, an occupation where there were two groups of workers in terms of their physical activity behaviors and their stress. And so these were double-decker bus conductors and drivers in London. And so if you're familiar with these double-decker buses, you have these operators who are going up and down, collecting tickets, moving around, and these are quite long journeys, and they're doing these quite often. And so these would be quite physically active individuals. Compared to the drivers, these drivers are doing quite monotonous, repetitive work, just driving, focusing on the road. So these was considered very sedentary occupations and also low stress. There's not a lot of thinking involved if you're following these routes for a long period of time. And so this study by Morris, they found they had access to data where they were able to chart their risk for heart attack, so acute myocardial infarction, and mortality after 3 months. And they found that across the board, across the age groups, conductors, the more active people, had a lower risk of cardiovascular disease and mortality compared to those more sedentary drivers. Now, the next question you might be thinking is, how do we know it's still not stress? So another aspect of their study was that they started to then look at another group of workers. And these were your postmen, your telephonists, and your clerks. And so the postmen are active on the job outside, carrying mail from house to house. And then you have telephonists. And in those days, they were people who were at switchboards. And switchboard work, as described in the study, was actually considered to be high stress. You're dealing with sometimes unpleasant conversations with people online, on the phone calls, and so considered to be high stress and also very sedentary. You're sitting down for long periods of time, and then you have your clerks doing very repetitive administrative work, seen as low stress and sedentary. And so what they found was the postmen, seen as more active, had lower incidence of heart disease and lower risk of mortality. And so I bring up this example because to me, we think a lot about physical activity as important in our leisure time, but actually the origins of physical activity epidemiology comes from occupational epidemiology and focusing on workers. In some way in this path to where we are now, I guess the story changed. The focus became on how do we actually influence physical activity outside of our working lives, because working lives are seen as very hard to change. Now, that was the challenge that I bring to my own research. How do we actually change and modify physical activity levels of workers, and considering their activities at work and outside of work? So I've brought up physical activity a lot, exercise. And if you think about exercise, it's this really amazing pill, this amazing medicine. It's this medicine you take for 30 minutes a day, 5 days a week. That's what we're traditionally told. And you get this whole host of benefits. Not only does it improve your heart health, it improves the way you feel, improves your strength. It has positive benefits on your mental health, and reduces your risk of certain types of cancer. And you'd be hard pressed to find any other medication like this. But the challenge is that there's no medication like this where you have to take it. I mean, there is, but this medication is particularly challenging to take because you're taking it and it involves you to commit to this, this pattern of 30 minutes a day for 5 days a week to really get those benefits that come from it. And so it's where we have to engage in exercise for long periods of time, and where it becomes challenging at a population level, where we need to actually incorporate it into our lifestyle. That's the challenge. And so I just want to start off with the first poll, and I'll just wait if there's ways in which this poll has to show up in front of you. But I would like to hear from you as to what you think the current physical activity recommendations are. And so the options are participate in at least 150 minutes of moderate intensity physical activity. So that's when you start to sweat a little and you start to huff and puff. Vigorous is when it's difficult for you to talk while you're exercising, you're sweating profusely, and you're combining some strengthening as well. And then the second option is to move as much as you can and include light activities, which we associate with chores, low intensity walking throughout the day. And then there's the 10,000 steps message, which is focusing on walking. And then there's a combination of these. So I'm seeing that the majority are focusing on either option 1 and 2. Oh, actually, no, 1, 2, and 3. Okay. All right, so I'm just, for interest of time, I'm going to stop and move to the next slide. But I think the majority have chosen either option 1 or 1, 2, and 3. And so can I close this? I think I'm just going to close and go to the next slide. So the actual recommendations as per the World Health Organization, and these were updated 2 years ago based on the strength of prevailing evidence in the last few years, is that we should all undertake regular physical activity, but they're promoting option 1, which is that vigorous intensity physical activity and a combination of moderate and vigorous with some strengthening of the muscles. And that's where we get the most substantial benefits from physical activity. But actually, it's a combination of option 1 and 2, where the Canadian guidelines, also published a couple of years ago, focus on a total 24-hour approach to physical activity and sleep and sedentary behavior. It's this idea that not only are we focusing on improving our moderate to vigorous intensity physical activity, we're thinking about what we're doing when we're not exercising. So trying to move more when we can, try to sit less when we can, and try to get good sleep. And there's this life course element to physical activity where as we're younger adults, we tend to be most active. And there's this, and the kind of that trend is both for exists for both men and women. But as we get older, things happen in our lives, professionally, personally. We have, other things going on, and then it just becomes harder to fit in physical activity. And so we find that in general, women tend to be less physically active than men. And then as we're getting to kind of an older age, then other things like our health, our mobility, and those also become challenges and barriers towards being physically active. And so there's this life course element. And so we're becoming less physically active as we get older in general. And then we think about the automation of work and digitization. And, I think of old Seinfeld episodes in the 90s where you see George in front of a desk with papers and not in front of a computer. That being so hard to imagine considering how work is undertaken right now in a lot of white collar jobs. We're not moving as much as we did. And so jobs are involving less physical activity, and there's been this general decline in every decade since the 60s. So then what do workplaces look like? Do they all look like, when we think about work and we think about working conditions and physical activity, I think a lot of researchers, at least in the physical activity world, what I've seen in conferences, tend to focus on white collar work. And it's easy to think of that because white collar workers generally have the resources to be able to invest in treadmills, health programs, standing desks, but that's really just a segment of the working population, right? And something that I've really emphasized in my work is thinking more across the board, the diversity of occupations. We think about work as in demanding jobs in terms of work stress and physical demands. Think about our daycare workers, our janitors. They're all doing different levels of they all have different barriers and facilitators to physical activity, and they also need to be included in our research in coming up with recommendations for safe and healthy work, physical activity. And so this social ecological framework is what I tend to refer to a lot in my own work, and it's really kind of thinking about this segment of the onion, this kind of cross section of an onion, where if we are to think about how to get workers to be more physically active, we need to go beyond this core, which is thinking about individualized behavior change, thinking about coaching, health education, and activity challenges, and so forth. Because on their own, they might help few people, but they're less likely to help populations of people. So we need to go beyond that and think about how do we actually influence larger groups of people, larger groups of workers. We think about how do we modify policies, how do we make supportive environments for people to think about their lifestyles beyond just thinking about only work, and then thinking about ways in which we can nudge people towards the direction of being physically active by changing their built environments. And so this was a study I was a part of a couple of years ago where we looked at how active Canadians are based on their occupations using Statistics Canada data. We find that on average, Canadians in full-time work spent 65% of their day being quite sedentary and not meeting the physical activity guidelines. But there wasn't a clear trend as to which workers were most active or least active. And so the most active workers, I think the more obvious candidates would be those in construction and trades and laborers who are active at work, and that work-related activity is probably contributing a lot to their daily activity. But then you're also seeing customer service representatives, people who are in more sedentary jobs, who are probably finding time outside of work to be active. And with least active workers, there's a wide gamut of different workers. And so we were really trying to understand what are these different factors that contribute to the activity, behaviors and profiles of workers at work and outside of work. There isn't a very clear occupation-specific pattern. And so, there's this connection between our working lives and our ability or engagement in physical activity outside of work. So you think about our working lives, some of these barriers that contribute to our motivations, our time availability to engage in physical activity include stress. And that stress means that we could be less motivated to engage in time for healthy exercise. If we're working long jobs, doing multiple jobs, not only are we impacted by stress, we might be having less time available in the day to do exercise amidst all the other things we have to do at home and the other factors as well that we have to deal with at work. And then the same with shift work and night work and physically demanding work. There's also this relationship between working in this physically demanding jobs can impact, even if it's in contributing to a lot of physical activity on the job, it can contribute to physical tiredness, which can take away from your ability to engage in physical activity outside of work. And so this all being said, I'd like to hear from you as to what you think we should be doing. Which of these different factors should we be modifying to support greater leisure time physical activity? So maybe I'll just give us about 15 seconds to answer this, or 20 seconds. That's okay. Okay, I think it's kind of slowing down the poll, but the numbers are overwhelmingly in favor of shift work and option 3 and 4, so long hours, multiple jobs, and shift work. And then we have a quarter of the votes around work stress. Okay, so I'm going to go to the next slide and just explain, well, I can't give you an answer right now, but we did explore this in a study which we published a few years ago. And we asked the same question: how do modifying working conditions affect recreational physical activity levels? And so what we did was we looked at a population-based survey, so the National Population Health Survey, and respondents who answered in 1994, how much time they engaged in leisure time physical activity. And they also responded on those different work-related questions. And what we did was we used a particular analytical method where we focused on those who reported some degree of change in their leisure time physical activity. And we associated that change, and we looked at the associations between that change with changes in their working conditions. And so from our sample, we found that there was about 3,000 people who reported some change over those 2 years in leisure time physical activity, and we wanted to see what contributes to those changes. And so the factors we looked at were, when you think about skill, discretion, and decision authority, they're kind of aspects of the demands and kind of our dominion of work, and kind of aspects of job stress. And then there was also a measure of asking explicitly, is your job stressful and hectic? And we asked, then the survey also asked questions on physical exertion on the job, if the job required a lot of physical effort, if you're engaged in more than one job in any given week, and then how long you spent on the job to kind of elicit long work hours, and then the type of schedule, a shift schedule you engage in, if you engage in shift work at all. And so I'm just going to go through these findings relatively quickly, just for purposes of time, but just kind of orientate you to this figure. This is a forest plot. And so in a forest plot, kind of just visualizing kind of the odds of how these levels of change in leisure time physical activity were influenced by these work factors. And you see that anything below this 1.0 line suggests that people are less likely to transition from inactive to moderately active because of these different working conditions. And so we find that the ones that stick out to us as being statistically significant in their associations were those people who had lower skill discretion, so ability to engage, to use their skills, or had very monotonous jobs, or had high psychological demands, high stress, and higher physical exertion on the job. These people were less likely to transition from being inactive to moderately active. We found that same trend when we think about going from inactive to meeting our guidelines of physical activity, the people we call as active in the population. And so, this to us suggests that these are aspects of work conditions that we could potentially modify and think about as being useful as considerations for strategies to to increase physical activity in the working population. And so that's really getting at this organizational, the second layer of this framework. And so the other thing that we wanted to tackle, or I wanted to tackle with some different researchers, was around this environment and the built environment piece, that third kind of the surface level layer of this social ecological framework. And so what I wanted to do is understand, how does access to supportive workplace facilities in around the workplace increase the likelihood that workers engage in more recreational physical activity? And so thinking about those built environments, and do they give you that nudge to move more? And so there was again, going back to Statistics Canada surveys, there was a survey in the 2007-2008 Canadian Community Health Survey that asked, at or near your place of work, do you have access to a pleasant place to walk, jog, bike, rollerblade, and playing fields, a gym, fitness classes, sports teams, showers and change rooms, and programs to improve your health, fitness and nutrition? And so with these questions, what we did was we looked at kind of the combinations of these facilities and what was available to respondents and how they responded. So on average, what was the probability that these respondents reported having different combinations of these facilities, and what percentage of these respondents that these combinations entailed? And then what was these associations between these combinations with engagement in leisure time physical activity? And so we found that a quarter of all participants had or reported having all these facilities available to them. And then, a similar quarter of the population also reported having none of these facilities available to them. Some people said that they had, access to and so these numbers inside these green boxes are just probabilities. And so some people said they had access to places to walk and playing fields, and then you get these other combinations as well. And so when we looked at the associations, and we looked at what was actually, we looked at these associations with leisure time physical activity, in general, we found that the trend was strongest, or the associations were strongest for people who had access to all the facilities, and those that had access to a pleasant place to walk, shower, and had access to health programs. And so we're trying to unpack some of these reasons. We found that maybe it is because people who have more options in their workplace, around their workplace, to engage in some form of physical activity were more likely to do so. And that's probably because people have different preferences, different opportunities that they're likely to do because of the way their work is and the way that work is structured. And I'll speak a little bit about the combination number 4 as well. But it was an interesting finding, and it just shows just the importance that the built environment can have in shaping physical activity behaviors. And I mentioned that quarter of the population also said that they didn't have any facilities available to them. And then we unpacked, their characteristics, and we found that in general, these people were those who generally have, the most barriers outside of the workplace to engaging in physical activity. These are the lower income, racialized person, lower income, lower education, in a physically demanding job, working long hours in a week, and reporting poor health and mental health. And so unfortunately, there's this paradox, this contradiction, where people that need physical activity the most are not getting it in and around where they live, and are not getting those opportunities in and around where they work. And so that just suggests to us that this is an area, a group of people that we need to focus on when we're thinking about interventional strategies. And back to that group 4, and so we tried to unpack some of those facilities and those combinations, and we looked at showers and change room facilities, and we found that when we look at them and we look at the contributions of them to different modalities of physical activity, we found that there seems to be this positive association between having showers and change room facilities and active commuting, particularly bicycling, cycling to and from work. And these trends were strongest for those who are older workers. So maybe there was this opportunity to be able to shower that made it easier for these workers to feel more comfortable while they're working, and not have to be all stinky and sweaty on the job. And so I've covered the layers of this onion where we're trying to think about ways in which we need to promote the positive benefits of physical activity. But physical activity at work can also be harmful. And so I just want to give a very quick overview of the occupational physical activity paradox, which I'm sure some of you have heard of, as well as speak to some of the kind of the contradictions in this evidence and why it's not completely set in stone that this is a paradox to begin with. And so what I mean by kind of physically demanding jobs and occupational physical activity is that it's not physical activity that is purposeful for exercise. When we think about exercise, it's something we do on purpose because we're trying to get some benefit from it. When we think about occupational physical activity, it's often done because it's a requirement of the job. Often it involves a lot of pushing, pulling, lifting, done in very short exertions, heavy loads with very little rest, very little time to kind of shift from that exertion to the next exertion. And so there's this growing body of evidence that suggests that this physically demanding work can have negative physiological effects. So when we think about exercise, exercise in general improves our fitness. When we think about fitness is in a very simplistic way strengthening our heart muscle and strengthening the way that our heart pumps oxygen around our blood and makes us, contributes to our metabolism and makes us healthy. But when we're thinking about short jolts of this physically demanding work and we're doing it with very insufficient recovery time, our heart muscle isn't able to really strengthen, but we're impeding our blood flow is going really fast. We're potentially hindering the way that our metabolic system works. It could, if we have pre-existing conditions, our vessels could be impacted. And then there's also this contribution physiologically with inflammation as well, where it impacts the way that our body and our metabolic system work to support our cells. So there's this growing body of evidence that suggests that this paradox is bad for you. And so I'm not going to go through the gamut of evidence, but I'm just going to try to not cherry pick, but cover some of the studies that show that there's this negative association with occupational physical activity and health. And so this was a study that came out last year. They looked at about 104,000 Danish adults, and they looked at this interaction between leisure time physical activity, which we associate with purposeful exercise and health, with physical activity at work. And so you see that if you look from the left going to the right, in the axis closest to you, that's our leisure time physical activity. And these are just the risk for cardiovascular events. And you see that as you move towards the right, from black to green, you see that, no surprise, the risk of cardiovascular events go down because these are people who are engaged in more physical activity for health. But then as you go, on your z-axis, you go away from you, and you focus on people who are engaged in high levels of physical activity at work and outside of work. These people also tend to actually have a higher risk of cardiovascular disease. And so it seems to suggest that this interaction where physical activity at work is bad for you, but particularly bad for you if you're interacting with leisure time physical activity. So maybe there needs to be a thought into ways in which we think about giving breaks to those who are engaged in a lot of physical activity at work. And so there's also this smaller evidence base on workers with pre-existing conditions, pre-existing health factors that might impact the way that their body functions, the way their heart functions, and then the way that occupational physical activity presents health risks. And so this was a study on nurses, and what it did is they looked at nurses generally of a middle age with either hypertension or with no hypertension, seen as classified as normotensive. And when they looked at those nurses with high levels of occupational physical activity, they had a substantially higher risk of heart disease if they had pre-existing hypertension. And so a similar pattern was seen with, this is a sample of men, and when they looked at the thickness of their carotid artery, we generally, this is generally classified as a symptom of atherosclerosis, so the way that clots develop around your arteries, especially around your carotid arteries. and that generally impedes your blood flow. And for people with pre-existing heart disease, they're more likely, if engaged in physically demanding work, have a higher risk of carotid artery thickness, development of clots, and these are all risk factors for subsequent heart disease compared to men with without pre-existing heart disease. So this all suggests that there's this potential risk gradient for workers with pre-existing conditions compared to healthier workers. And then this is another study just kind of outlining, again, links with fitness. And fitness, I'm saying, I mentioned before, it's kind of linked to the way that our heart as a muscle is able to do its job or not, or how healthy or strong our heart muscle is. And you find that workers with lower fitness tend, there's this general trend with workers with lower fitness tend to be generally at higher risk of heart disease compared to those with higher fitness. And so, to kind of bring this message home, I like to think of it as kind of being comparable to snow shoveling. And I apologize because this is a terrible slide to bring up for you at this, this kind of, as we move towards spring, especially for maybe the Ontarians in this call, which I'm sure I might be the only one because we've had a lot of snow this week. But there's kind of this parallels with physically demanding work and snow shoveling when you think about just how we go about doing it. And so when you think about snow shoveling, you wake up in the day and you wake up in the morning, you haven't done a lot of warm-ups, you haven't given your heart a lot of time to kind of adjust to the cold environment you're about to go to. People may or may not have pre-existing heart conditions and and other conditions. They're going out and they're shoveling the snow. And then when you're shoveling the snow, you're lifting up pretty bulky snow, and then you're doing it, your legs are stationary, your arms are doing a lot of movement. And every time your arms are doing those movements, your heart is just shooting up, working really hard, your heart rate shoots up. And there's this like jolt of your heart beating. Your heart is working really hard to kind of pump oxygen around your vessels and to your muscles. And so there's this very physically demanding work you're putting on your body, and puts a lot of strain and stress. And if you read this article by Auger et al., it really outlines this kind of very underestimated risk of heart disease that comes from snow shoveling, especially for those who have pre-existing health conditions. And so it really helps, I think, when I give this message to help people think about parallels between this physically demanding paradox and snow shoveling. And so I mentioned that the evidence can be mixed, and the evidence is mixed because there's a lot of different ways in which these studies are carried out. And so what we did is we wanted to kind of explore these different physiological effect mechanisms that have been postulated as being linked between this physically demanding occupational paradox and health. And so we looked at inflammation because that wasn't really explored a lot in the literature. And we wanted to see, inflammation is kind of linked to diabetes and then heart disease. What are the links between occupational physical activity and leisure time physical activity and their interaction with diabetes risk, type 2 diabetes risk? And so that was what we asked. And there's a publication here which we published last year. And so what we did was we had a data set with the 2003 Canadian Community Health Survey, and we had these respondents, those who were working respondents, linked to the Ontario Diabetes Database over 15 years. And these were healthy workers. So we focused on workers without any prior diagnosis of diabetes in the first 2 years of follow-up. And so we found that when we're looking at people with high levels of leisure time physical activity on their own, these workers were anything lower than this line showing 1.0, and this is the figure in blue on the left, were at lower risk of diabetes if they had high levels, so if they're meeting the physical activity guidelines. But then as they but there isn't a very clear trend when we're thinking about just occupational physical activity on its own. If they're engaging in low levels of occupational physical activity, be it stationary or some level of movement, or high levels, there wasn't this pattern or trend with diabetes risk on its own. But when we factor in the two together, there's this interesting trend where when we think about workers who are very stationary on the job and with low levels of physical activity, but very physically active at work or meeting the guidelines. So this table, the box on the left, the very left, these people are at the lowest risk of diabetes. But as you move to the right, and we're factoring in more physical activity on the job, and then as you move more to the right of each figure, more physical activity outside the job, these people actually tend to transition more towards no diabetes risk. But kind of the trend is also moving away towards benefit. And so the main findings in our work is that the benefits of physical activity tend to be the strongest on its own and for those who are most sedentary at work. But workers with most physically demanding occupations tend to benefit the least, though not statistically significant in our findings. So it suggests that maybe we need to be thinking about what workers do on the job and outside the job when we're designing or tailoring physical activity recommendations, and maybe focusing on the most sedentary occupations first. And so I talked about the evidence being missed, and there's different reasons for why this might be the case. And so with our study, and many of the studies in this field tend to focus on the healthiest of workers. And so we kind of had to do that. We did that because it just helped us kind of eliminate this reverse causality possibilities. But in general, these types of large surveys, large Statistics Canada surveys that we and other surveys that other studies in other countries utilize, there's a lot of bias towards kind of healthier workers who respond to this work. And so we may not have a good understanding of what happens to those workers who have pre-existing health conditions. Another reason the evidence might be mixed is the way that we measure occupational physical activity. And so we tend to focus on occupational physical activity as it's self-reported by people, but people who self-report this occupational physical activity there tends to be this bias of over-reporting where people tend to say what they think the researchers want to hear. And so with our particular study, we used a job exposure matrix where we based on our occupational physical activity on a matrix of consensus measured physical activity, but even that isn't enough when we think about how physical activity can vary within occupations and not just be averaged. So we've kind of, with the next stage has been monitoring, and we think about Fitbits and activity monitoring devices, but these are generally worn on our wrists or on our waists, and they capture movements very well when we're moving with a stride or we're just walking, but they don't tend to capture movements when we're lifting, pushing, and pulling. We need more monitors around our body. And so there's some studies coming out of Denmark and Scandinavia, which are capturing this full body movement. But and I'm hoping in the next few years we'll have a better understanding of this paradox in terms of accuracy of measurement. And so my last poll question is, how do you think, considering this evidence of the physical exertions and physical demands of work, what do we think we need to be doing, and what do workplaces need to be doing to promote safe, physically demanding work? So again, I'll give another 15 seconds. And so the first option is don't do anything because there's not enough high quality evidence. 2 is promote safe workplace practices. 3 is promote breaks and rest. And 4 is a combination of 2 and 3. Okay, so the overwhelming majority at this point is for 2 and 3, so option number 4. I'm just going to end the poll just for purposes of time. So yeah, that's and I would say I'm in agreement with this majority. And in my summary, I would say that when we think about working conditions and how they hinder physical activity or are promoted, if I was to give a recommendation from the work that I've seen and from my own work, I'd say that we need to be thinking about supportive policies and supportive policies that give opportunities for workers to think about their lifestyles, think about ways in which they can address their stress, the physical demands of work, so that they can think about physical activity. And so it's the thinking about beyond an individualized approach to promoting workplaces and employers to support workers to be able to do things for their own health. And then thinking about the built environment, and that built environment can have an important role in nudging and shaping the decisions that workers make in thinking about recreational physical activity and exercise. And also thinking that some workers already have more access to built environment facilities for physical activity than others. And maybe we need to be more inclusive and thinking about more equitable approaches to supporting physical activity among workers that don't have the opportunities that some of us already have. And lastly, and this kind of ties in with, and the next slide will ties in with that, the last poll, which is that there's this growing evidence base around occupational physical activity being detrimental for health. And there's this, and the potential link of these risks being stronger for those with pre-existing health conditions, but the evidence till now isn't conclusive. And if you've seen the latest guidelines by the World Health Organization, they haven't provided anything specific for workers. And so, and that is just to say that this isn't necessarily closing the shop, but saying that more evidence needs to be available for us to really say that we need to address it. But that being said, I wouldn't say that that because there's not enough evidence that we need to not to be doing anything at all. And in fact, maybe because there is enough of a signal to say that there is potential risk of physically demanding work and cardiovascular disease and mortality, we need to be thinking about ways in which we can support physical activity of workers, and the responsibility should be on providing safe policies, supportive policies, and the responsibility should be on organizations rather than individual behavior change, and tailor those recommendations where we can provide not only safe policies, but approaches which address the capacities and ability and supports of the workplaces, decide where certain workers who maybe have engaged in a lot of physical activity outside of work maybe need to be thinking about taking rests and taking breaks from physical activity if it's very onerous on the job, thinking about warm-ups before engaging in physical activity on the job, thinking about that snow shoveling example. And so it's really tailoring these recommendations to the needs and capacities of individual workers. And so that's the end of what I wanted to explain. But if you are interested in learning more, I've provided a summary of this information as well as a whole host of references in a recent conversation piece that I had published a few months ago. And so if you're interested to learn more, feel free to check out that link. And you can always reach me by my email and Twitter account. So thank you for your attention and looking forward to the questions.